I'm so excited to welcome you to our new course, Understanding Data and Statistics in the Medical Literature. Whether you're a member of the general public trying to understand health headlines, a medical student reading their first journal articles, or a healthcare professional trying to use the latest research to improve patient care, understanding statistics and data has never been more fundamental for extracting information out of the medical literature. Take this representative journal article from the journal PLOS Medicine. This is a straight-ahead medical article, but the parts we've highlighted here depend critically on understanding statistics and data to be able to read. So if you don't understand statistics and data, you'd be hard-pressed to understand what this article is all about. And that would be true of most articles in the medical literature these days. We've seen the consequences of not understanding statistics and data. This is an article published in 1998 by Dr. Andrew Wakefield and his colleagues. In this article, they collected 12 patients, and they observed a relationship between the MMR vaccine and autism. Later, the lead author of the article, Dr. Andrew Wakefield, recorded a video where he suggested that there might be a causal relationship, despite the statistics not backing up that claim. This article was subject to selection bias. The patients weren't selected scientifically. It had a small sample size of only 12 patients, and it absolutely did not demonstrate a causal effect. Despite this, many people believe that vaccines do in fact cause autism, and people have started to elect not to vaccinate their children, leading to some of the largest measles outbreaks in the United States since the introduction of the vaccine. All of this is despite the fact that since then, many more statistically rigorous studies have been conducted, and study after study after study, and many more all show that there's conclusively no relationship between the vaccine and autism. So this shows the consequences of not understanding statistics and what that can mean for medical literature. Another example is hormone replacement therapy. Hormone replacement therapy was considered a potential therapy for coronary heart disease and to reduce the risk of that disease. In particular, this article showed that there is evidence that estrogen therapy might decrease the risk for coronary heart disease. The study was based on a collection of other studies, a meta-analysis, and this collected set of studies showed that there was this relationship. Later, a clinical trial was run where patients were randomized to either receive therapy or not receive therapy. And this trial had to be stopped early because it showed that not only did the therapy not work, but it might actually not be more risky to be taking the therapy for coronary heart disease. One of the key factors that was probably at play in making the meta-analysis not work was that there was a confounding factor. In many of the studies, there was not an adjustment for socioeconomic status. And hormone replacement therapy was primarily used by women of higher socioeconomic status. These women were also at less risk for coronary heart disease. And so the confounding influence of socioeconomic status possibly made it look like the therapy was working more than it was. So what is this course about? This course is a high-level course. It's introduction to the concepts and statistics and data that you need to know for the medical literature. It's efficient. We try to keep it moving quickly and only cover the material that you absolutely need to know. We try to leave out the mathematical detail and focus on the conceptual ideas. And so the idea behind this course is that anyone can pick it up and have a better idea of what's going on in the medical literature, even if you don't understand all the mathematics behind the statistical models being used. So this is an introduction to statistics in the medical literature. We cover things like bias, sample size, estimation, uncertainty, confounding, and more. The course is taught by 2 statisticians and a medical doctor, Lucy D'Agostino-McGowan, Elizabeth Matsui, and myself, Jeff Leake. We're super excited to tell you more about statistics, which we all use regularly in our research. It's for professionals and students in the health sciences, but it can be for anyone who's interested in learning more about how statistics and data work in supporting medical arguments. The course uses real examples from the medical literature. We have short lessons. We try to keep them between 5 and 10 minutes, and the whole course is doable in about 4 hours. So we hope you can fit it into your busy schedule. We're incredibly excited about statistics and data, and we're excited for you to join the course.